This morning, health officials in Kansas are reporting the largest documented outbreak of tuberculosis in U.S. history. 67 active cases of TB and 2 deaths, with dozens of other asymptomatic cases. TB is one of the world's leading infectious disease killers and is spread person to person by germs that can stay in the air for hours.
You do need prolonged contact with an infected individual. If you briefly come into contact with somebody in the community, it's not very likely that you're going to contract tuberculosis. The exact reason for this specific outbreak is not yet clear.
It comes as the Trump administration changes the way federal health agencies communicate. The Department of Health and Human Services has been told to pause all non-emergency external communications until they're reviewed and approved by a presidential appointee.
Information is the lifeblood of public health. It's how we respond to outbreaks, how we respond to public health crises. And stopping that, I think, is unjustifiable, and I'd like to see that change very quickly.
The new rules on communications are causing concern after the U.S. detected a different, more rare strain of bird flu in California. A farm there reportedly forced to destroy nearly 119,000 birds. Despite 67 human cases of bird flu in the U.S. and 1 death, there's been no confirmed person-to-person spread.
When people have symptoms and get tested, we can identify if they have bird flu, but I do think there are probably dozens, if not hundreds of cases out there that we have missed.
Sources say a CDC report on bird flu was not released last week because of that pause on communication from health agencies. As for those TB cases in Kansas, experts say this outbreak is not something the public should be immediately alarmed about, saying TB is treatable. Andrew Dimbert, ABC News, New York.
Watch breaking news on YouTube. Subscribe to ABC 7 Chicago Eyewitness News.